Probably the two biggest questions patients have going into surgery is what the recovery is going to be like and how much it's going to hurt. Obviously, surgery hurts, but the vast majority of my patients don't even need narcotics. We use a variety of multimodal pain therapies during surgery and in the recovery period with the goal of really trying to avoid narcotic pain medicine. And most patients find that that's very effective. I usually have a 30-minute to an hour conversation with the patient in the office to review what's going on, make sure they understand what the surgical options are and what they're getting into. And some patients will have one or two more visits before surgery, but a lot of patients, it's that one visit and then we meet at the surgery center or hospital to go ahead with the procedure. The patient gets another opportunity to ask questions, then make sure that they understand what the recovery process is going to look like. And then after surgery, they get multiple follow-up visits, either by phone or in person, to make sure that they're recovering as expected and that all of their questions are being answered. Yeah, we've had quite a bit of experience with evaluating and treating patients that aren't physically here in Moscow already. A lot of those patients will have an initial conversation on the phone just to establish what's going on and what they're needing help with, followed by a more detailed video consultation where I can examine visually what's going on and also just talk through all the details of their problem and the surgery with them. Those patients also get another follow-up visit in person shortly before the surgery, usually the day before the surgery, to make sure that there's no surprises and that things haven't changed since we talked on telehealth. And then they'll get an in-person visit before they leave town and then multiple additional virtual follow-up visits. A lot of the surgeries that we're doing for Veritas patients are not emergencies. So there's often lifestyle changes in terms of weight loss and diet modification and exercise or physical therapy that patients can pursue. So a lot depends on what the patient has already tried, if they've already exhausted those options, or if this is just affecting their life so much that there's not really any good options to move forward at this point. I think a lot of patients have been told that they need to see a surgeon or that they need a surgery by their primary care doctor. And while that's often true that it's worth consulting with a surgeon, the answer is not always surgery. And so a lot of patients are surprised to learn that they do have other options, or that surgery comes with risks that may not be worth the potential fix. One way to think of general surgery is that we're focused on safety and function. So we're making sure that the body continues working well, and we're trying to prevent severe complications of blockages and infections down the road. Yeah, a successful surgery in my mind is when the patient is able to get back to normal life. So for a hernia surgery, that means the patient's able to get back to full work without any limitations, without pain that prevents them from being able to do their day-to-day activities that they want to, whether that's work or outside of work. For other surgeries, it means patients that are able to eat normally and participate in family and social life without having to worry about intestinal symptoms or GI issues that brought them to me in the first place.